That third trimester, it's such an incredible time, isn't it? It's filled with so much excitement and, let's be honest, probably a whole lot of questions too. Well, that's exactly why we're here, to walk through some of the biggest concerns, giving you clear, straightforward information so you can feel totally prepared and empowered for the amazing journey ahead. All right, let's just dive right in and tackle those big questions that are probably swimming around in your head right now. Things like, is my baby in the right position? If I've had a C-section before, what does that mean for this birth? And the big one, am I going to know how to push? We're going to take all that uncertainty and turn it into real confidence. So first up, let's talk about these final weeks of pregnancy and get right to a concern that so many mothers have. What position is my baby in for birth? Okay, so most babies, they just kind of know what to do and they settle into a head-down position. That's what's considered ideal for a vaginal delivery. But if you find out your baby is breech, meaning their little bottom or feet are pointing down instead, it is totally normal to feel a little worried. But here's the good news. A lot of babies are little acrobats in there and they'll turn all on their own, sometimes right at the last minute. You know, your baby's position isn't just random. There are a bunch of things that can influence it. For instance, the amount of amniotic fluid. If there's more fluid, the baby just has more room to do somersaults and flip around. Even the position of your placenta can play a role. The point is, your medical team is keeping a close eye on all of this stuff to help guide you on the safest path forward.
So, thinking about the baby's position, that naturally leads us to our next big question. And this is a really important one for any mom who's had a C-section before. What are my options for delivery this time around?
And that brings us to the big topic of VBAC, which stands for vaginal birth after cesarean. This is a huge deal, and for good reason. It's an incredibly personal decision, and it's something that you and your doctor will really explore together, looking at your specific health and your pregnancy. What's really helpful here is seeing how doctors think through this. It's not just one thing, it's like a checklist. For example, they look at how much time has passed since your last C-section. Having more than 36 months gives that uterine scar more time to heal and become really strong. They'll also ask why you had the first C-section. Was it for something that's not an issue this time, like the baby was breech? If so, your chances for a successful VBAC could be even higher. And really, that's the main thing to remember. This decision is never based on just one single factor. It's all about looking at the entire picture of your health and your baby's health. Because at the end of the day, the goal is always, always the same: a safe and healthy delivery for both of you, no matter how it happens. Okay, so once you start getting a clear idea of your delivery plan, the next thing that comes to mind is preparing for labor itself. And you know, when it comes to labor, feeling like you're in control is just everything.
Let's talk about the epidural. It's one of the most common ways to manage pain during labor, but there are so many questions around it. So let's just break it down and demystify what it is and exactly how it all works.
And what's great is seeing that something that sounds maybe a little intimidating is actually a very calm, controlled, step-by-step process. It all starts with just having a conversation. Then they'll help you get into a position, curling your back, to make it easy to access the right spot. The procedure itself is quick, and before you know it, that relief kicks in. The whole thing is designed for your comfort. Now, this is a super important point. An epidural is designed to block the sharp pain, not every single sensation. You will still feel the pressure of the contractions, which is perfect because that's your body's signal telling you when it's time to push. It basically lets you rest up and save all that energy for the final stage, which is so, so important. And here we are, the moment everything has been leading up to. After all the prep, all the laboring, knowing how to push in a way that's truly effective can make all the difference in the world. Okay, so when someone tells you to push, what's the first instinct? For a lot of us, it's to tense up our whole face, hold our breath way up high in our chest, and just strain. It feels like you're doing a lot, but believe it or not, that wastes a ton of precious energy and isn't actually helping move the baby down. So the key is to work with your body, not against it. You wait for your team to give you the green light. Then, when you feel a contraction start, you take a big, deep breath, hold it, and focus all of that energy on pushing down low, almost like you're having a bowel movement. That directs the force exactly where it needs to be. Then, in between, you breathe, you rest, and you get ready for the next one. It's a rhythm: work and rest. All right, we have talked about the baby's position, delivery options, pain management,
even pushing techniques. All of these are incredibly important, but what is the single most powerful tool that you have with you during childbirth?
What is this number all about? 500 milliliters. It might seem completely random, but this is one of the most critical numbers in childbirth. This is how much oxygen-rich blood flows through the placenta to your baby every single minute during labor. And this is why staying calm isn't just a nice little suggestion, it is a physiological necessity. When you start to panic, your body releases stress hormones that can tighten up your blood vessels, and that can actually reduce that vital flow of oxygen to your baby. So your calm, steady breathing, that is literally helping to supply your baby with oxygen. And this is the message, the one thing to hold on to. Your body was truly built for this. You're going to be surrounded by an entire team of professionals whose only job is to keep you and your baby safe. So trust that process, trust them, and more than anything, trust in your own incredible strength. You've got the knowledge, and you have a strength inside you that's more powerful than you can even imagine. This journey ahead is all yours, and now you are so much more prepared to walk it with clarity, with power, and with confidence. You've got this.